I'm Dr. John Ward, Director of the Coalition for Global Hepatitis Elimination at the Task Force for Global Health in the United States. I'm honored to lend support to this important discussion on ways to protect newborns in Kenya from hepatitis B. Around the world, hepatitis B is a major health threat. About 254 million persons are living with this chronic hepatitis B infection that leads to progressive liver damage, till the liver becomes severely scarred, known as cirrhosis, or the development of liver cancer, the third leading cause of cancer deaths around the world. This viral infection oftentimes progresses very silently, with the person not knowing they're infected. So diagnosis is very important for that infection to be caught early, so that person can receive the care and treatment that can reduce by at least half their risk of disease progression toward liver cancer. Yet most persons with hepatitis B remain undiagnosed and untreated. As a result, in 1 year, 1.1 million persons die of hepatitis B, a disease which is preventable and treatable. Compared to the world, Kenya is a country with a high burden of hepatitis B. About 2.4 million persons in Kenya have chronic hepatitis B, and that infection causes about 12,000 deaths per year. Yet in Kenya, less than 1% of persons with hepatitis B know that they're infected after receiving testing. Now, those that have been diagnosed, many receive treatment, showing that treatment is possible after diagnosis. But we have a real challenge to increase the ways people can get tested so that they know their status and get the care and treatment that they need. So these numbers are an urgent call to action. Kenya needs strong strategies to prevent, diagnose, and treat hepatitis B. Now, regarding prevention of this life-threatening infection, we have a key intervention: hepatitis B vaccine. Children infected during birth or in early infancy are at great risk of becoming chronically infected and progressing toward liver failure and liver cancer as they age into adulthood. For our newborns, that's about a 90% risk of remaining chronically infected if they become infected during birth. And for infants, it's about a 50% risk if they get infected through exposures in households and other settings. So it's very important for that hepatitis B vaccine to be given to children starting in the first 24 hours of their life. And that has been a WHO recommendation since 2009 that every newborn receive hepatitis B vaccine. To give maximum protection, it's very important for that hepatitis B vaccine to be given in the first 24 hours of life, for that birth dose vaccination to reduce that risk of lifelong infection. If that infant or newborn, as they age into adulthood, they have about a 1 in 4 risk of dying early from hepatitis B-related liver disease, including liver cancer. So it's very important for that vaccine series to start with the newborn, and for that 3-dose series to be completed in infancy as the child receives other vaccines recommended for them. The very good news about hepatitis B vaccine is the long-lasting protection after that vaccine series is completed. Multiple studies have shown that protection lasts for at least 40 years. So it's a great benefit really throughout the life of that individual to receive that timely hepatitis B vaccination. Hepatitis B birth dose is very safe, can be given with other medicines and other vaccines received by the newborn. The inclusion of hepatitis B vaccine in the National Immunization Schedule has proven to substantially reduce the number of children infected with hepatitis B in the countries that have implemented routine hepatitis B vaccination for their children all around the world. Now, in addition to introducing hepatitis B vaccination of newborns, another opportunity is to routinely test pregnant women to see if they're infected with hepatitis B. Now, that has several benefits. For the child, delivery of hepatitis B vaccine within that first day of life. Secondly, the mother can receive antiviral medications that lower the amount of virus in her blood, so it decreases the risk of transmission to her child at the time of birth. And then thirdly, diagnosing a mother with hepatitis B can help that mother receive the care that she needs. Timely hepatitis B birth dose vaccination, screening of pregnant women to really truly close the door on any ways that that virus can be transmitted to the child, while at the same time seeking ways to benefit the health of the mother. Scale up of hepatitis B birth dose vaccination in Africa can have tremendous health benefits. 2 out of every 3 new chronic hepatitis B infections occur among children of Africa, including Kenya, of course. Now, if we can get that vaccination coverage with that hepatitis B birth dose up to 90%, we can prevent 500,000 deaths from hepatitis B among children in Africa that are vaccinated this decade. That's the opportunity we have for tremendous improvements in health in Africa, including in Kenya. Now, introducing the birth dose is very cost effective. This is a very low cost vaccine. Multiple studies have shown that it's tremendously cost effective, if not cost saving, for countries to vaccinate their newborns as part of the infant immunization schedule. For example, the neighboring country of Ethiopia has conducted a study showing that the addition of the birth dose would avert over 10,000 disability adjusted life years at a cost of just $110 per disability adjusted life year, saved a small fraction of the national health expenditures for the country. Importantly, African countries have introduced birth dose showing high acceptance among families and successful delivery within health systems, even in resource-limited settings. As Kenya, immunization experts and policymakers consider the way forward, routine hepatitis B birth dose vaccination, the evidence is clear. Introducing hepatitis B birth dose is a smart investment in health, longevity, and the economic well-being. I and the Coalition for Global Hepatitis Elimination strongly support this step toward routine hepatitis B birth dose vaccination in Kenya and stand ready to assist you in any way we can in advancing access to this life-saving intervention for the children of Kenya. Thank you.